Welcome to Issues. As you know, Issues is a program that we look at what's taking place in the community and bring this to you, our viewers. The topic that we're going to cover is happening now as we speak. And we have with us to explain what is happening, Dr. Stanley James. Dr. James?
Yes, sir.
You're quite a debonair person. You're on the radio, preach at churches, on TV, a medical doctor. All right, Dr. James.
Thank you. Thank you.
Good to have you here.
Thank you. Nice to be here again.
Now, Dr. James, in the second part of our program, we're going to be talking with Dr. David Cavan.
Yes.
He wrote a book concerning diabetes.
Yes.
Now, share with us, please, how did you meet him and how did he end up here in Bermuda?
Certainly. Well, the Bermuda Diabetic Association had a program that they had launched, and they brought in international experts. He was one of them. He was actually the director for programs and policies at the International Diabetes Federation in Brussels. And he was traveling around the world, which was part of his responsibilities. And one of the places he came to was Bermuda to address the Bermuda Diabetic Association about the prevalence of diabetes in the world, what is being done, what can be done to actually manage it. After his presentation, I was struck by the name of his book, Reverse Diabetes, and haunted by our philosophy of lifestyle intervention and management. Our
philosophy meaning the Seventh-day Adventist Church?
Yeah,
yes.
You know, being nurtured in that context where we try to use lifestyle as a primary intervention before going into medication management if possible. I was excited about the possibility that here was scientific evidence and a book written about reversing diabetes. So I asked him at the end of his lecture for his card, got his book, and began to read it feverishly. And I emailed him and said, would you coach me into how I can actually do this myself at a clinic level? Because the book was really written just for individuals. And he said, well, it hasn't really been done at a major clinical level. And then I did more research and reached out to a friend at the Harvard University, where I discovered the diabetes prevention program in the United States was a large trial which showed that people with pre-diabetes, they actually can manage that with lifestyle and not medication. And this was really huge because at that time, most people were being treated with metformin, a medication, or glucophage, and for their pre-diabetes. But they showed that with changing your diet...
Let me just back up. Pre-diabetes, now what are some of the symptoms of pre-diabetes as compared to diabetes? Or maybe there isn't a difference.
Right. Pre-diabetes will be determined by laboratory evaluations by a physician. But it's at risk. You put you at risk for becoming diabetic in a certain number of years. So it's important that if the earlier you can intervene with diabetes, the better it is for avoiding blindness, erectile dysfunction, kidney disease, heart disease, strokes. So pre-diabetes proposes that eventually you become diabetic, but even when you become diabetic, there's some microvascular damage that's happened that you may not be showing symptoms with. So getting on top of your diabetes early is very important.
How does one test then for should diabetes testing be part of one's annual physical?
Certainly, your physician is checking for pre-diabetes, and will tell you that you have pre-diabetes when you have it. And then, of course, when you come and give you the medication or the instruction on what to do with pre-diabetes when you have that.
This through a blood test?
Yeah, you do a blood test, exactly. So once I put that together, that there was community-based program for managing pre-diabetes, I came with the idea, maybe we should do a community-based program to manage diabetes based upon the information in Dr. Cavan's book. So I launched the idea to him, and I asked him, would you kind of guide me as I kind of do this? And I did that at one of the clinics that I was working with previously. And we had some modest improvement in the patient's overall care, that they were actually beginning to show reversal based upon those very principles. Then when I took over and became the medical director of the Premier Health and Wellness Center, one of the things I wanted to do was provide a wellness philosophy that did more than just treat it with medication, but also showed that we can choose lifestyle as a primary intervention for reversing or managing diseases. So I contacted Dr. Cavan and told him what I was doing, and he said, keep him posted. Then he emailed me, and when he emailed me, he asked me how are things going. I gave him an update. And he said, well, I'm about to move from Brussels at the International Diabetes Federation and then go to London. I said, well, why don't you come to Bermuda and help launch a community-based program here? He thought that was a novel idea. And he even says that, it must have been inspiration, because it was just at that time that he was thinking, what would I do now? And that came up. Long story short, we remained in contact. He wrote a curriculum designed for Bermuda with the help of the Bermuda Diabetic Association, which localized the information so they can kind of make the diets and things that fit what we eat here in Bermuda. And then Argus Insurance, we went and knocked on all the insurance doors, the GHI, HIP, and Argus. HIP and GHI did not respond with an interest, but Argus took it on, and they were very excited, and they were very passionate, so much so that they committed to journeying with us to make sure that this was successful.
That's a big accomplishment, I would think, getting Argus to sign on to this program.
Well, yeah, they were, it's very much a part of their core values and their philosophy, and they were passionate about it, and they stuck with us and made this happen. It's really remarkable, the level of commitment that they've demonstrated to the Premier Health and Wellness Center.
So does this mean that the other major insurers won't cover anything at all in terms of diabetes should the patients come to you?
No. BF&M subsequently have also agreed to participate, and Colonial also participates as well. Okay. Those patients do have a small copay, but the Argus insurance patients don't pay anything for the program. Mm-hmm. So all the insurers, private insurers, actually engaged and participating, and also excited about the prospect of their patients being a part of this program. Okay. So then, of course, Dr. Cavan came, and we began the program. It was in our early stages. He wrote the book, and Sarah McKittrick from the Bermuda Diabetic Association, Dr. Daniel Kaningu, who is a medical doctor at my practice, the Premier Health and Wellness Center, and Dr. Cavan are the lecturers that actually deliver the program regularly.
Wow. And how is it going so far?
Excellent. We are seeing patients who are coming off of medications, others with tears in their eyes as they say they've been a slave to their drugs and now they're free. Others who have lost weight and feel they got more energy. Others who took a new philosophy on their overall health to know that you can actually take control of a disease that has been taking control of you.
Wow. Now, and I know this is not your area, but is there a point with type 2 diabetes that maybe it's too late for your program to work?
Yes, there are patients who have gone so far that it's not too late to use lifestyle. It's never too late to use lifestyle as an intervention, meaning change your diet and exercise and learning how to be coached and eat correctly. But some patients, the damage is so far gone, you won't get your kidneys back by doing this program. You won't get your sight back by doing this program. You won't get your heart back if you've had a heart attack as a result of poorly controlled diabetes. But you can ameliorate and prevent it from getting worse. And so it's never too late to start implementing these principles. But the reason we want to have reasonable expectations. So we're really targeting people who have diabetes and are suffering and want to avoid blindness, want to avoid amputations, want to avoid being on dialysis, and want to avoid heart attacks. If you want to be in that, if you want to avoid those things, using medication is okay, but medications do have side effects. Using natural principles and wise principles of how to eat will reduce the need for medications, reverse the disease process, and avoid these damaging sicknesses that people have as a result of poorly controlled diabetes.
So does this program advocate, once a patient comes to Dr. Cavan and starts the program, does it advocate, well, stop your medications now and change your lifestyle? So, is it cut off the medications now, or is it cut it off gradually?
Very good question. So the initial encounter, you have an assessment by Dr. Cavan. He'll sit and talk with you, look at all your medications, get a referral from your doctor, read your doctor's referral note, and he assesses your readiness to change. Is this program suitable for you?
Wow.
Not everybody, because says that comes, is going to be chosen. And it's because you have to show that this is something you're up to. You must be showing that you're interested, that you're ready, that you're capable of following through. There's no point getting you on a path that you're not going to be successful on. So the initial assessment is not just to check you out physically, but also check you out emotionally, mentally, socially. Are you able to fulfill what's required to make this lifestyle change? So once that's happened, Then you enter into a program in which you have an intensive education about what is diabetes, how it is affecting you, what are the medications you use, what are the side effects of those medications, what are alternatives to being treated with medication, how do you implement those alternatives, and then you're in a group setting which supports you for a year-long journey through this whole process of reversing your diabetes.
This sounds really comprehensive.
Oh, it's comprehensive. It's definitely, you have a dietitian, you have an endocrinologist, you have a primary care physician, you're in a group setting, and this whole program, after the first 6 weeks, you ask, will you be just stopped off your medication? You are actually monitored medically by the endocrinologist to ensure that your medications are being adjusted based upon how your disease is progressing as a result of the lifestyle change.
You know what, Dr. James, I'm going to throw out a request. I know you will be off the island for a period of time, but when you come back, I'd like you to bring Dr. Cavan, and I'd like to bring a couple of your patients and hear from them how things have been going. It's interesting that you have group meetings in terms of, I guess, encouragement, and I'm sure that helps, but like to hear from some of your patients.
Sure.
And what I find interesting too is that I guess if you don't have the mindset to make that change, that lifestyle change, then maybe your program is not for that individual.
Right, and that's important. Readiness to change is very important in terms of as you're motivating or interviewing anyone to engage in any type of major shift. Are you ready for this? And we have to determine that before we just get you into something, and it's wasting your time, wasting the resources of the insurer, and also, frustrating the group and also the care providers.
Let me ask, of those who are on the program, have any of them dropped out either because you, the physician, says, I don't think you're serious about this, or the patient themselves says, well, I don't think I'm ready for this? So have any of your patients, to your knowledge, dropped out of the program so far?
Not one.
Not one.
Because the pre-screening is, done to make sure that the people who are in the program will have a higher likelihood of actually succeeding through the program. People are very passionate, they're very excited. There's many people like they have a new lease on life.
Wow.
And it's very simple, but I think the group effect, working in a group that shares a common story, the information that you get about the disease process, and then the interventions that are recommended on how to evaluate your progress, change certain things that you're doing, and how to pick yourself up when you fall down.
Very good. We've been talking with Dr. Stanley James. In the second half, we're going to meet the man that he's been talking about, Dr. David Cavan. We will be right back. Welcome back to Issues. In the first section, we were talking to Dr. Stanley James, and you heard Dr. James mention David Cavan. Now we actually have David Cavan with us, and we're going to find out some more about this treatment for diabetes. But Dr. Cavan, welcome to Bermuda and welcome to Issues.
Thank you very much. It's great to be here.
Now, let me ask a broad question. What would be a workable definition of diabetes?
A very good question. Diabetes essentially means that there is too much sugar in the bloodstream, in the circulation. And it arises from a number of different problems. But there are two main types of diabetes that people will be aware of. The first is type 1 diabetes. That's when the body stops producing the hormone insulin that is required to keep the level under control. And so the levels in the bloodstream build higher and higher and higher. The big problem here in Bermuda and in many other places around the world, though, is type 2 diabetes. And that's a condition where the body can produce insulin, but it just doesn't work properly. And so although insulin is there, it's not effective. And so the level of sugar in the blood rises and rises, and over time that can cause a lot of big problems.
Now, diabetes, is it something that is preventable with proper diet or through medications, or is it preventable?
So type 1 diabetes, as far as we're aware, is not preventable. It's an autoimmune disease like many others, and we're a long way from understanding exactly why it happens. Type 2 diabetes is almost always preventable. So if we think in Bermuda now, there are something like 13% of the population, I think that's nearly 7,000 people, have type 2 diabetes. If we go back 20 or 30 years, it would have been much, much less than that. So what's changed? The population hasn't changed a huge amount, but what's changed is the environment in which we live, and in particular, the lifestyles we lead and the foods that we eat.
And that's where we're going to be headed in a little while. Now, what are some of the symptoms of type 2 diabetes?
Type 2 diabetes, actually often it doesn't have symptoms because it's something that comes on very gradually. As your blood sugar rises, you can feel a little bit lethargic, maybe your mind doesn't work quite so clearly, a bit more tired. But often it occurs in people who are getting older, they're usually putting on weight, and they may just put it down to, well, you know, getting a bit older, shall we say. Once the sugar levels reach a higher level, then some of the typical symptoms appear, and that's getting very, very thirsty, passing a lot of water, and blurred vision because of the high levels of sugar in the eyes. But actually, you can have diabetes for some years and just not get any of those symptoms.
So it's something that, is it something that you could go to your doctor one day, take a regular blood test, and there it is with type 2 diabetes?
Absolutely. And in many countries now, family doctors are screening for diabetes in people at high risk, and that's how people are diagnosed.
Okay. Now, you wrote a book. Tell us a little bit about that book, because from that book, it's my understanding that a whole new world has opened up for some individuals with type 2 diabetes.
Well, so I'm an endocrinologist. I've been treating diabetes all of my professional life, and for most of that time, up until 5 years ago, I was using medication as the main means of treating it, because to be blunt, that's how doctors are trained to write prescriptions. And then about 5 or 6 years ago, I began to realize that there were lots of new medications coming out, big promise, big hope, this is the one that's going to make a difference, and actually they didn't. So actually then for the first time, I started really asking people, well, what is it that you're eating? What is your lifestyle? And from that, began to realize that that's what we need to tackle first and foremost. And that was about the time that I'd been asked to write a book to support people with type 2 diabetes in managing it. And we chose to call it, the title was Reverse Your Diabetes, because there was by then very new evidence that actually if you can change your lifestyle, you can reverse the processes that happen inside that cause it.
Let me ask you, is that accepted by the medical community in terms of changing your lifestyle, or is the medical community still saying you need the medication?
The medical community and all the guidelines across the world will say that the first thing you have to do in treating type 2 diabetes is to encourage the individual to become more healthy, to have a healthy diet and do regular exercise. Having said that, I think, and I was one of them, most of the medical community didn't really think that made much difference. So we'd pay lip service, if you like, but then start writing prescriptions and rely on medications. The evidence that it can be reversed was very controversial when it first came out, but the evidence came from very well documented, well conducted studies by well-respected researchers. But a lot of the medical community still think, well, it might work for some people, but it wouldn't really work in my patients, and so they haven't really embraced it. Those of us who have are seeing really great results.
Yeah. Now, what is the main thesis of your book or lifestyle change?
So the main thesis is that type 2 diabetes is largely a result of our modern day lifestyles, which by and large means that compared to maybe 30 years ago, we're eating a lot more unhealthy foods, especially sugary foods, processed foods, sugary drinks, fruit juices, and at the same time we're exercising a lot less. And I don't mean by exercising going to the gym or running long races, but using walking to get around, using a pedal cycle, being active in our places of work, whereas nowadays so many of us just sit behind a desk all day. The combination of those changes has led in just about every country around the world to more and more people developing type 2 diabetes. So the thesis behind the book is, well, okay, now that we know it can be reversed, what can we do to reverse those lifestyle changes and think back to how we lived or how our parents lived 30 years ago? And by and large, it's a question of eating real foods, avoiding processed foods, and very specifically, avoiding where you can those foods that will make your blood sugar level go up.
Such as?
Well, obviously you will realize that anything with sugar in, when you eat, it goes into your bloodstream. So we really encourage people to minimize sugars wherever they come from. I hear people say, well, fruit's great because it's natural, and fruit juice is great, but it's natural. But actually, yes, they are, but it's still sugar. And if you think of fruit juice, you know, an orange was designed to be eaten as one orange, not to be squished into a, you know, 6 together in a glass.
What about artificial sweeteners?
Artificial sweeteners, well, there's debate as to whether there are problems associated with them, but in terms of diabetes, they do not have the direct impact on blood sugar. So if you have a very sweet tooth, I'd much rather someone have a diet soda or a sweetener in their coffee than sugar. Okay. So cutting out sugars as much as you can is the first part. The second is realizing and understanding that all starchy food, once it's got into your body, is turned into sugars. And I know...
What are we left to eat? Vegetables?
Yeah.
Oh, you're saying yes.
Amongst other things. So trying to replace the starches, and I'm learning how starch is a part of the diet here, macaroni and cheese, scalloped potatoes, things that people really enjoy, cassava pie, which I've never seen, but I understand is very important. But actually understanding that those foods to your body are sugar. And if you have a condition like diabetes where your body cannot handle sugar, it makes sense to really cut them down. Not eliminate them completely, but try and cut them down and replace them with vegetables, you know, good, wholesome, fresh vegetables. You know, fresh meat, fresh fish is, you know, very fine. That will not affect your blood sugar levels. And if you want a little bit of rice or pasta, then have that. But try and make it a small part rather than the main part of what you're eating.
So you're saying lots of vegetables, fish, and if you just must, then a small amount of the starches such as rice and pasta. Yes. But again, what about those fruits? You know, the grapes, the oranges.
Well, all fruits have sugar in.
Yes.
And so I say to people, you know, I love fruit. You know, fruits in themselves are healthy. They've got lots of vitamin and minerals in them. But be aware they have sugar. So having maybe a small apple or a small orange twice a day is probably okay. Having a large serving of pineapple or watermelon or, you know, some of the large bananas, which could have a huge amount of sugar in, is probably not such a good idea.
So fruit, at least the sugary fruit, is not really good for you in terms of diabetes prevention and in terms of lifestyle change.
In terms of, so we have to distinguish now between prevention and actually treatment or reversal. Okay. So the evidence is that up to 3 servings of fruit a day is good for you in terms of overall health. Okay. Once you get beyond that, fruit doesn't appear to protect you, and it's probably because you're getting too much sugar. Okay. Once you have diabetes, the key is to remove the foods that would increase your sugar level. So cutting back on fruit is part of what we recommend.
Now, how do you know, Dr. Cavan, that your program is working?
So, as I said, this philosophy formed part of the book that I wrote some 3 years ago. Almost immediately, I started getting feedback from people who'd read it and who'd said they'd come off medications, they've lost a lot of weight, their doctor said they no longer have diabetes. So there's that indirect evidence, you like, that it works. I'm very privileged to be able to be here in Bermuda at the moment because it's giving me actually, for the first time, to design a program based on the principles of the book, where I'm seeing firsthand the results. And the people who've come through the program you know, they're telling me things that I wouldn't even believe, to be honest. You know, they're coming off their medications, they're losing weight, they're feeling better, they've got more energy, and it really is great to see.
So what period of time has this been since you have been treating your patients here in Bermuda?
I arrived in Bermuda at the beginning of February, so the first program started, I think, on the 1st of March. And so the people who came through that program have already seen.
So you're saying within 2 months,
oh yes,
you've seen changes?
Yes.
Is that normal in terms of seeing
Yes.
change?
If people are willing to make changes to their diet, and one of the things that has really struck me here is just how much sugar people eat and drink. Mm-hmm. Even if they have diabetes, it just seems to have become so much part of the culture. And so, you know, to be honest, it's a choice. Would you like to come off your medication? If so, stop drinking sugar and cut down the amount of sugar you eat. And people have adopted that choice. Okay. Come off medication. Some of them have come off insulin injections. Their weight is coming down, their blood sugars are coming down, and they're feeling really good.
So then, and you said it was the #1 factor, then is the elimination, for those with diabetes, the elimination of sugar from your diet?
As much as you can.
As much as you can. Then you said, I believe, is it exercise? What would be the second part of it?
Well, so sugar and then cutting back on starches.
Starches, yes.
I have to say, I never say never. Mm-hmm. Because, you know, a number of people have a sweet tooth. I actually have a sweet tooth. Mm-hmm. So if there's a special occasion, don't feel guilty about having a piece of cake or an ice cream. Just don't make it part of your regular routine. Mm-hmm. The other part of it is physical activity. Yeah. And I don't use the word exercise because that conjures up all sorts of images of going to the gym
yes.
and running and what have you, but just using our legs. Mm-hmm. You know, we've been built with a very good machine to get us around, and far too many of us just don't use our legs. Yeah. You know, we use motorized transport, we use anything other than walking. And building and walking into your routine itself makes a massive difference.
Okay. We have been talking with Dr. David Cavan. He is a doctor over at Bermuda Premier Health and Wellness Center. We spoke with Dr. James earlier, and we heard some more of this. But again, those of you with diabetes, I would strongly suggest that you get hold of Dr. James and Dr. Cavan and start that treatment. Dr. Cavan pointed out that within 2 months, he has seen significant changes. And I have heard personal testimony from a lady who indicated that since she has been going to Dr. Cavan and been following what he has suggested, she is doing much better in terms of her diabetes. So again, Dr. Cavan, we thank you for being on Issues.
Thank you very much indeed.